Hi, my name is Kara Zerby. I'm going to be doing IV insertion today. So once we've already checked the order for accuracy, we're good to go ahead and perform hand hygiene, gather our equipment, which we already have here. We've got the alcohol swab, the tourniquet, the IV catheter, which is a 20 gauge because it's pink, our transparent dressing, our stat lock stabilization device, our J loop connected to our normal saline flush that has already been primed and is already connected, ready to go. And then we have some gauze. So the first thing we're going to do, provide patient privacy. We're going to identify our patient using two identifiers like name and date of birth. Once we've done that, we can go ahead and ask the patient about their right-handedness and left-handedness. This patient is left-handed, so we're going to use their non-dominant hand, or arm, which is their right arm, and we can then inspect from hand to shoulder. I'm going to go with the basilic vein today. So then we are going to go ahead and apply the tourniquet about 5 to 6 inches above the site where we want. Okay. Once we have done that, I'm going to go ahead and don my gloves. And as we've already stated, we have chosen our IV catheter to be 20 gauge, and it's pink. That's how we know it's 20 gauge. So after we have donned our gloves, we're going to go ahead and prepare our site by cleaning it. After that, we want it to fully dry. We don't want to blow on it or anything and introduce it to any microorganisms. After it has fully dried, we're going to go ahead and insert our IV catheter at a 30-degree angle. So once we have applied traction first, we'll go and bevel up 30 degree. Okay, I've seen a flash of blood. I'm going to advance with the needle a little bit further. Once I have advanced with the needle, I'll go ahead and advance just the catheter all the way until it reaches the skin. And we're going to apply pressure there after we remove the needle. Activate the safety, remove the tourniquet, and then if there has been any blood, we are going to wipe that up. We're going to connect our J loop to the hub, and again, if there's any more blood, just kind of clean that up. Okay. We're going to stabilize it with the stat lock and the transparent dressing. We're going to check for blood return, so we're going to slightly aspirate. I've seen blood, so it's okay to flush the IV, meant to ensure patency. Once we have done all of that, we're going to chart all of the things that we did, like chart the date and the time of the IV insertion, the patency of the IV, the size of the gauge that we used, 20 gauge, the dressings that we used, if the IV site is leaking or if it was difficult to flush, or how well the patient tolerated the insertion, how many times it took us to insert that. Once we have gotten everything documented, we're going to go ahead and put our biohazard in our biohazard container and our sharps in our sharps container. And that's it.